Well, hello, everyone. Yes, yes, yes. Good evening. Good evening. It's me, Dr. Naita. I'm back and welcome to Educational Moments with Dr. Naita. I am so glad you're here. Look, I always tell you we have a great show tonight, but you know what? Tonight is going to be spectacular. I have such an awesome guest, and we have such an incredibly important and relevant topic tonight. So, look, tell your friends. You have to share this link. You have to go on YouTube. You have to log into Facebook. Tonight, you want to be here because we're talking about a topic that everyone needs to know about. Look, I'm so excited. I forgot to put on my earbuds, but let me take care of that now. All righty. So, our topic tonight is COVID-19, and we're coming from a scientific, non-clinical perspective. It's going to be good. So, look, tell somebody, share this link. Grab a paper, grab something to write with, and make sure you have your beverage. I have mine, you know I do, and come right back. All right. Well, welcome back. Welcome back. Back. I'm so glad you're here. Look, I am just trying to get into Facebook, make sure everything is going okay here. And it looks like it is. Hey, Regina. She says she is checking in. Regina, I have an incredible topic tonight. We're going to have a great time. So look, I'm just going to, I see Facebook is on point. Okay, that's good. I'm excited about that. Anybody out there in YouTube land, please drop a line and let me know that everything is good in YouTube land. So look, without further ado, I want to talk about our guest. Our guest tonight is phenomenal. She is the Renaissance woman. Okay, she is the 21st century incredible woman doing her thing. And, again, tonight we're talking about COVID, and we've heard so much. We've heard the politicians speak about COVID. We've heard medical doctors speak about COVID. We've heard religious leaders. We've heard people who have read 2 articles on the internet, and now they are the subject expert. But tonight, we're going to hear from a medical scientist. So without further ado, I want you to give some love, and I want to see some clapping hands and emojis on social media, but I want to give some love and welcome to the show, Dr. Lourdes Norman-McKay. Woo! Hi, Lourdes. Dr. Norman-McKay for this evening. I am so glad you are here. How are you this evening?
I am great, and thank you for that warm welcome, Dr. Naida. I am just delighted to have a chance to talk with you and your viewers and answer questions because there's some confusion out there.
Yes, there is. There is. So look, before we get started, I want to talk a little bit about, I want my viewers to get a chance to know who you are, because I know you and I have known you a long time, probably more. I don't even remember us meeting. Okay, because we've known each other that long.
17 years or so, at least. Yeah.
Yes, at least. So, but would you tell us a little bit? And I do see some clapping hand emoji. So thank you for that. Thank you. Will you please, tell us a little bit about your academic journey and how you have arrived to where you are today?
Yeah, sure. I'm happy to share that. So I grew up here in Jacksonville, Florida, and I went to University of Florida and was studying microbiology and was trying to decide what I wanted to do when I grew up, and I ended up going to Penn State College of Medicine, and I studied there and became a medical scientist there. I got my PhD in biochemistry and molecular biology,
Okay.
and was doing a lot of work on cancer research. I was doing diabetes research, and then went on and did a postdoctoral fellowship through the National Institutes of Health in microbiology and immunology, where I was studying viruses. Actually, I was studying a virus called human T-cell leukemia virus, and it's a sexually transmitted virus that does cause leukemia. And it
Oh, wow.
especially, a lot of people don't know about that kind of a virus. It's,
I've never heard.
always the focus is HIV, but there is another sexually transmitted virus called human T-cell leukemia virus, and mainly infects. The biggest problem actually is in Native Americans tend
Mm,
to suffer the most from it. Um, but there are populations, Latin populations in South Florida, where it's also found to be endemic. And that's actually my background. I'm Latina. So I was doing research and on my way to being a bench scientist and doing really well at that. And I started to think a lot about how much I really enjoyed the times where I was teaching
okay.
and connecting with students. And I decided that I wanted to go teach. And I thought it was really important for young women, um, especially underrepresented groups, which women are of themselves underrepresented in STEM, but also
Yeah.
Latina and African American women in particular are underrepresented. And I thought I could really be a good role model for young women and empower young women and youth in general in STEM and help them break down those barriers, which I myself have encountered. I don't know if you've ever seen the Netflix special Picture a Scientist,
I
but if
have
you
not.
haven't, oh, you have to watch that. You
Okay.
definitely have to
Picture
watch
of
it. Put it
science.
on your view list. It's emotional. And there are a number of women scientists who participate in that conversation, but three in particular who kind of lead the charge on it. And it's just really demonstrative of the challenges that women have faced in science, and especially there's a great focus there on minorities in science. So I would definitely encourage you to watch it. But that's kind of my journey. And from there, I've been involved in all kinds of things at the collegiate level, teaching. I've been an administrator. I have a textbook with Pearson that I write that's used all over the world to teach our future healthcare providers. So nurses primarily, but also PAs, nurse practitioners, and so on. So that's a little bit on my journey. And my goal is really to make science accessible. I think that scientists need to do a better job of talking like normal people. And
Yeah.
let's be honest,
Yes.
and reaching people and helping people understand things in a way that they can relate. And so, thank you so much for giving me this chance to hopefully to do that and answer questions that people might have.
That is awesome. And I just love how you just threw that out. And yeah, I wrote a book for Pearson's, number one publisher in the world. And then I went on and did that. But I'm going to say this, that I've been a fan of yours for forever. And I remember when you were named the dean. Or I don't remember if dean or associate dean, but
Yeah.
I remember when it happened. And then I remember when you made the announcement that, oh, I have a contract with Pearson's, the largest publisher in the world, to write a textbook, not a pamphlet, everyone. I want to make sure you hear this, a textbook. If you don't believe me, I'm going to share it. Let me show you my screen. So here it is. So this is, and make sure you all can see that. And let me remove that comment. So this is the picture of the current book. It's Microbiology, Basic and Clinical Principles, and it's by Pearson's. Okay. And not only is this book already in circulation, this textbook is in circulation globally, but she has written, is it the revision?
It's the
And
second edition. Yeah.
second edition, and this will be the cover. They're going to clean it up, of course, make it textbook, but this is what the cover. And I think you shared with me a very important announcement about this picture. Why is this picture so important? And why was it important to you to have this picture on the cover of your next textbook published by Pearson's?
So, in case you haven't noticed, there aren't a lot of Black professionals and minority professionals pictured on the covers of textbooks. And these are real healthcare providers. Lolly, who's on the left, she's Latina and she's a nurse practitioner. And then Paul in the middle, he's also a nurse, and my former student Ariana is there too, and she survived a brain tumor and never missed class, mind you. So that's why she's on my poster child list. But this
Absolutely.
is you it's really hard to find pictures of real people
Mhm.
in textbooks. They're often models, and these are real healthcare providers. And this is the first time that a minority Latina woman and a Black man on the cover of a biology textbook with Pearson. So I think that pushing to get students to be able to picture themselves in these roles, it's really important for building their STEM identity.
Yes.
And we have to do better at that. And even though, and you know what's so great, Naida, is all of these people who were in that picture, and we did a whole
Mhm.
photo shoot. We've got lots of pictures that we're going to be making sure that we show real healthcare providers of all diverse body types, ethnicities, races, everything.
Ah,
And despite these people being so busy because of COVID, especially here in our town, they
mhm.
took time to come and do a full day of this photo shoot with us. And because I said, I got Pearson to agree to this, to do this photo shoot, but if people don't show up,
Mhm.
then it doesn't matter. Like,
Right.
I need to have people represent. And they did. They came out and they were just a part of this really important movement. And I want to continue it. I really want to diversify who we're showing in our textbooks and showing young professionals of all ethnicities and genders. But I think it's really important too for Black men to be represented
Yes.
in these products too. Um, White women and Black women, I mean, first, mostly white men have been
Mhm.
represented, and then white women, and then Latina and Black people, but it's not near where it should be. It's not representative. So we're going to work on that. And I was raised by a strong Dominican woman, so we're gonna get there. Claro que sí. Pues vamos a hacerlo.
Awesome, awesome, perfecto. Right. I'm going to show one more picture, and can you tell me why this picture means so much to you?
Oh,
And tell everyone who
Yes,
see it.
Dr. Kismikia Corbett. She is our hero. She is
Yeah.
a national hero, and I'll tell you why. Not only is she a strong woman who looks great in this picture, doesn't she?
Yes.
She is brilliant. She is such a brilliant young mind. She's like 34, 35, and she is the lead scientist behind the Moderna vaccine for COVID.
Yes.
And she just actually accepted a position at Harvard
Harvard.
University. Yes.
Read that today. Yes.
So her star is rising for
Yeah.
sure. But this is just a great example of she was a part of a program at her college. She came from North Carolina,
Mhm.
and she was part of a great program at her college that helped to empower underrepresented groups in STEM. And thank goodness we had that, because
Yes.
without her, we might not have a vaccine that has saved a lot of people.
Absolutely.
So it's just
Absolutely.
a reminder about how important diversity is in finding the best solutions to things. I tell my students, like, okay, when we think about diversity in sciences, let's pretend that you're looking at a liquid and it's red and it's sweet, and you taste it and you go, boy, that tastes like Kool-Aid. Well, that's from your culture. That's what you know and that's what you've experienced. But let's say that you have a beverage from some other country that you've never been to, and you would not know at all what it is. You would try to make a close approximation. You would say, well, it tastes kind of like it's this other thing. But if you had diverse people on your team, someone might be able to tell you exactly what it is.
Mm-hmm.
And you can just imagine how when we all bring this different lens to a problem and our own experiences, our own background, just how much richer our problem solving could be and how we could really get at better solutions, probably
And
faster.
faster. Yes,
Mhm.
we're saying it at the same time,
Yeah.
and faster and faster.
Mhm.
All right. Well, very good. Well, I think we've laid a foundation. I hope by now people know that you are approachable, that you know how to break it down in the simplest of forms, where in the chunks where people can understand, and to the point where they can turn around and share the right information. So, with that being said, as we know, we've heard a lot of information out there about COVID, and some is just some things are just not worth repeating. So I don't even want to discuss that. What I want to talk about today is, Lourdes, please tell us about COVID. You know, what's on your heart? What would you like to share with us tonight about COVID or variants and transmission, all of that? The floor is yours. Talk to us. I'm monitoring the comments. So if anyone has any comments, please just type it in on YouTube or type it in on Facebook, and we'll put your comments and questions out here. So we're ready.
Yeah. So, this is this is something that is hard for me to watch unfold, actually. Just people needlessly suffering because we do have a prevention now, and the distrust that's there. And mind you, in terms of minority populations, that distrust has a history. That
Mm-hmm,
distrust has a history.
mm-hmm,
And we need
mm-hmm,
to not be afraid to look at that and turn that over and get better. Um, but what I also see is a lot of confusion and fear. There's a lot of fear that people have about the vaccine. There's a lot of confusion about variants, and it can be hard to know who and what to trust. Um, and I feel very fortunate that I can understand this and read
mm-hmm,
the first, the primary literature and dive through this. And I have a background in this and can understand it. And my family can come to me and ask questions. My friends come to me and ask questions. And I try to guide them based on the science and
mm-hmm,
keep politics out of it,
mm-hmm,
keep all of those things that take our power away, honestly,
mm-hmm,
from the truth of things and
mm-hmm,
empower us to make decisions that we can use to protect ourselves and our families.
mm-hmm,
And I think that the best way to move forward is for us to have these open conversations where people, I mean, I can understand how people are scared. When it comes to vaccinating yourself or your kids, you want to make the best decision, right? We spend our whole lives trying to protect our families, trying to take good care of ourselves. And so this is another one of those decisions. And what I can say is a pandemic is not a surprise.
mm-hmm,
This is what viruses do. We've had pandemics in the past throughout history. We will continue to have them. This is not the last virus that will afflict humanity. And given how much we travel and our global environment and all these things that are changing, it's inevitable. And in fact, right at the start when all this was coming down, I had a student reach out to me, former student,
mm-hmm,
now a nurse in here in Jacksonville. I have lots of former students who are in
mm-hmm,
healthcare here in
mm-hmm,
Jacksonville, and said, "Dr. Norman, do you remember when you said about 10 years ago that it's not a matter of if, it's a matter of when we have a respiratory pandemic?" And I said, "Yeah, I say it every semester because I know it's a matter of time."
mm-hmm,
And he said, I thought you were being overreactive. I thought you were just, being dramatic." And he's like, "I can't believe this is actually happening. What is going to happen to us?" And I said, well, we've come through it before and we'll come through it again.
Absolutely.
But we do have to work together. And so I'm hoping that I can help some other people feel comfortable about their decisions with this. And that's just where I'm coming from, empowering people with information that's accurate.
Okay, well, very good, very good. Well, thank you. We appreciate the passion and just the sincerity that you're coming from a true place, a true place of concern and compassion for humanity. So, with that being said, I think one of the things that a lot of people struggle with is the variants, and
Mhm.
what is that, and why is this occurring? And we have Delta, we have Mu, and who knows what else is next. So what is the variant? What is that all about? And
Right. So most people are familiar with the fact that we get a different flu shot every season,
hmm
right?
yeah.
And that's because the virus that causes influenza is a virus that changes very frequently. And the virus that causes COVID-19, SARS-CoV-2, is similar in that it also changes a lot, just like influenza virus does. And this has to do with the way that its genes are. So the genetic material that is in the COVID-19 virus um, doesn't have spell check. We can think of it like that. So when it copies its genetic information, it makes mistakes pretty frequently, much more
Okay.
so than viruses that do have spell check, viruses that cause things um, that other vaccine preventable diseases that we have that we don't need as frequent of changes of vaccines, like, you know, pretty much every vaccine where you don't have to have this seasonal shot is a DNA virus,
Okay.
and that means that those viruses have spell check, and they
hmm
don't make as many mistakes when they copy their genome, so they don't change as quickly, if that makes
hmm
sense.
Okay.
Um, but things like influenza, things like SARS-CoV-2, these RNA viruses, they change really quickly. And in fact, smallpox, which we've eradicated, that was a virus that was really commonly circulating, very deadly DNA virus. If it had been an RNA virus, we might have a different story about that eradication process. Because it had that spell check and didn't change that frequently, we could stay ahead of it. And the way that we are going to get ahead of SARS-CoV-2 is to trace what its changes are, its mistakes, its typos when it makes its genome copies, and make vaccines that allow us to learn about that strain, about that variant before it becomes prevalent in a population. Um, I will say these variants, a variant is any version of the virus where there's a genetic change. And that genetic change might confer a benefit to the virus. It might be detrimental to the virus. It could be neutral in its effects on the virus. And what's happening is because there are so many cases, every single time that that virus has a chance to invade and infect a patient, it has the opportunity
To
to
change.
mutate and change.
Okay. Got
Mhm.
it. Got
And this is obviously a problem. And this is where we're getting these new variants.
it.
And just through probability and statistics, the chances that at some point it's going to make a change where it has some sort of improved capacity, it's just there. I mean, that's what we're seeing with Delta, right? More transmissible, it generates a higher viral load in patients. Um, which is suspected to lead to a worse illness in patients. So not only is it more transmissible, but because of that higher viral load, it can be more dangerous. And we're seeing on the horizon other variants also emerging, and this is not unexpected. But here's the thing. Even young people who are out there saying, well, if I get COVID, I probably won't get that sick. I definitely won't die. I mean, number one, you don't know that. But let's pretend you're right. Let's pretend you nailed that and you got lucky. You didn't get super duper sick. You didn't die. Um, that virus could still mutate in you, and
Mhm.
you could be the next source of a new variant. And that's what's happened. So this is why it's really important, even for people who are young, who might not get really really sick, to get vaccinated because it helps us stay ahead of these and prevent these new variants from arising. And that will be the goal from a scientific standpoint, is tracking what the variants are, getting ahead of them, and then having booster vaccines and it'll be a seasonal thing. We'll see this moving forward. Just like we have seasonal flu vaccines, we'll have seasonal COVID vaccines to help stay ahead of new variants. And that's how we're going to beat COVID. And that's how we're going to make sure that it's not draining our medical systems, because that's what we have to do. We're not going to get rid of it completely, but we need to make it manageable to a point where it's not putting this huge strain on our social systems. It's not this increased risk to the massive numbers of people who have suffered from it, especially people in areas that may not have as good of access to healthcare. And that's where we are with variants. And they are not a surprise. They have been expected. It's been part of the conversation since the outset, and monitoring has been globally really extensive to look for those variants.
Yes. Well, we have lots of comments, so let's look at some. One person, I don't know, you may know this person, I'm not sure, but she's saying that don't forget your flu shot. And I am no longer trying to dig up evidence to prove vaccines cause autism. There is already abundant evidence. This debate is not scientific, but is political.
So to prove vaccine, so is it, Gloria, are you saying that vaccines cause autism?
Okay.
Or is this, somebody is saying this, Dr. David?
Minute Congress. Okay, it's a lot of, yeah, this is pathetic and luxury. Okay, we will yeah, I think she is saying that she does believe that they do cause it does. So we're also getting a lot of other, yeah, we have a lot of people coming on, they're not in agreement with the vaccines. And okay, we'll accept that. Thank you. You don't have to write the same post like 5 or 6 times, but I do see those. So we do appreciate that. And I think that we're going to always have. Let me see. Let me try to take this down. We're going to always have whatever. There's always going to be an opposition to anything that is presented. There's always going to be.
There is, but I mean, I would like to say something about it, the autism piece. My niece is autistic, so I mean, and I understand people who have autistic children want answers, and I would want the same were my children autistic. There's a really good study with 95,000 participants in it that were tracked and looked at incidence of autism vaccinated versus unvaccinated. And there was absolutely no correlation there to suggest that autism and vaccination were even correlated. Not even correlated. Never mind causation. Not even correlated. And that's a really big data set. The big thing where people were all worried about vaccines causing autism had to do mostly with a preservative that used to be in vaccines. It's not anymore. Hasn't been for 20 years, thimerosal. And the big brouhaha over that was that it was a mercury-based preservative that was damaging neurons. And first of all, I want to make it clear, like the mercury form in thimerosal is not the neurotoxic form. So you've probably heard of chlorine, yes? Right?
Mm-hmm.
Okay, so the atomic abbreviation for that is Cl. And NaCl is salt. It's great on fries, okay? Chlorine in its pure form, though, is dangerous. Chlorine gas is dangerous, and that will definitely be damaging. So the form of mercury in thimerosal is not that form of mercury that you think of when you think about mercury poisoning. But even if that was your concern, it's not in pediatric vaccines anymore anyway. And you know what? Ever since it was taken out, guess what? rates of autism haven't changed. It's not something that's linked to that, and the data are very clear that that's not the case. And here's the thing, there are only so many people to turn over all these rocks and do this research. And if we want to know what actually is causing autism, we need to stop turning over the same rock. Like,
Ah,
we need to start focusing on other things, people, because the money, the resources, the people hours on this, if we keep trying to turn over the same rock, we've done it and it's not there. And we need to start investing our resources to find where it really is.
wow.
So this is where it is a problem. And if those of you who really are convinced that vaccines cause autism, you're doing the autistic community a real disservice, because resources are getting wasted on trying to look under a rock where we know that that's not where the answer is. So I don't know what else to say on that front, but the data don't support that. And if we want to keep pushing that that's what it is, then we won't get to the real answer, because you've already found the answer, apparently.
Okay. Well, we have a comment here, and it goes back to something that you were saying about the unvaccinated population. And I think she's asking, well, I don't know if Ellsworth is a man, probably a guy, possibly a guy, is asking, so unvaccinated people are a playground for mutations. I don't know if you want to call it a playground, but that is where it occurs, correct?
It's any active case of infection. And
Mhm.
as it stands right now, your chances of being an active infection are higher if you are unvaccinated.
Okay, very good. Thank you. All right, thank you. So, with that, can we talk a little bit then about breakthrough cases? And do you want to use any of the slides that you sent? Anytime you want me to put one up, I have them. I have them here.
Yeah, sure. I mean, if you want to, I think if you have the variant slides, we can show the breakthrough cases. There are a couple of slides on that might help illustrate kind of what's happening.
Okay. Let me see if this is the one you want. This one is on the Delta variant. And that one. Okay.
Right. So, yes, this is the Delta variant. And what this is just showing is the spike protein and some of the mutations that have caused changes in that spike protein that lead to some differences in the Delta variant as compared to the Alpha variant that was previously more prevalent. And this is I mean, we know a lot about this protein at this point and what it looks like. We can view it literally and model it and see what these mutations do to change its behavior. And a few things. One, the spike protein, there's more of the spike protein on the Delta variant than on the previous circulating Alpha variant. And the way that these mutations have occurred in the Delta variant, it makes the spike protein stabilized in a form that makes it easier for that variant of the virus, to attach to our cells and invade and cause infection. So maybe click to the next one. I'm trying to. Right. So let's just talk a little. You can change it again. What is a breakthrough case? It's any infection that occurs in a person. COVID-19 positive test result in someone who is at least 14 or more days out after having received their vaccinating dose. So for Moderna and Pfizer vaccines, a vaccinating dose would be your second vaccination. For the Pfizer vaccine, or sorry, for the Johnson Janssen vaccine, that would be just after your first dose, because there's not a second dose for that one. And breakthrough cases are not a surprise. No medical intervention is 100% effective 100% of the time. That doesn't mean it's ineffective. Just because something is not 100% effective 100% of the time does not mean it's ineffective.
Mhm.
And what we do know about breakthrough cases is that in general, they are not as severe or as common as cases in non-vaccinated people.
Mhm.
That's what the data show us. And the problem, though, is that whenever there is a breakthrough case, people want to point at that and say, see, the vaccine doesn't work. The vaccines work. The
Mhm.
data are very clear that the vaccines are working.
Mhm.
Um, so let's talk about how a breakthrough case might happen, and why in some areas where there's high transmission, people have been asked to wear masks again. And that this has happened in our community, for example,
Mhm.
where the CDC has changed recommendations about mask wearing. And basically, what it has to do is if you have a variant that's more transmissible, and it's like trying 1,000 keys to get through your immune system door versus trying 10 keys with a less transmissible variant, the chances that it's going to find the
Mm,
right key to get in will be higher, because you're going to be exposed to 1,000 virions rather than 100, let's say,
right.
um, because the viral load is higher with this variant, and therefore the transmission is enabled a bit more. So that's a little bit about Delta variant and some of the things it can do, and what breakthrough cases are.
So the mask, is this why we should wear masks or shouldn't wear masks? And there's so much controversy over, should you wear a mask? And I heard people talk about how the person would wear a mask and then they could get other infections and diseases. Well, clowns, just like underwear, you change those every day. Change your mask every day. Nasty.
I mean, I healthcare workers wear masks all day, all the time. Like, it's not, and they're not dropping dead from, some mask transmitted infection. So, I mean, I don't know. It's fascinating to me where these ideas have come from. And I mean, I get it. I don't like wearing a mask. It's not the most
Yeah.
comfortable
It's
thing,
not cute.
obviously. It's not, I wanna
Yeah,
wear
I
my
have on my
lipstick and
lipstick and yeah, I
of
get it.
course.
But
But,
my life.
well, the thing is too that there's this concept that because a mask isn't gonna prevent all virions from accessing you or you expelling them, that they're not useful. And what people are failing to understand is this idea of what's called an infectious dose. You have to be exposed to a certain dose of the infectious agent. We call it an ID 50, infectious dose 50, to be infected.
It's called the infectious dose. Is that what you said?
ID, infectious dose 50. And what that is it's the dose at which 50% of susceptible hosts, that is, people who could be infected.
Did I spell that right? Infectious.
Yes.
Okay.
And it's the dose at which 50% of susceptible hosts, so people who could potentially become infected, are
Mhm.
infected. And for some viruses, that numbers, you don't need it. Well, big exposure. For other viruses, you need a larger exposure. The most infectious virus that we know of to date is measles. Um, yes, measles.
Mhm.
So, but there are other very infectious viruses. Chickenpox is another one. And
Mhm.
the Delta variant is as infectious as chickenpox.
Wow.
And if you think about this before, I mean, most kids now are getting vaccinated against chickenpox. And, but if you think about it, Naida, when we were kids, we got chickenpox.
Yeah, I got them.
I got them too. Everybody got them.
Yeah,
I mean,
yeah.
nearly everybody got them. And so if you weren't vaccinated against chickenpox, you got chickenpox most likely. There are some exceptions, of course, but by and large, people got chickenpox. And that's how infectious that virus is, and Delta is as infectious as that. That's the analogous level of infectivity. So the idea is that you wear a mask to decrease how many virions you may be expelling. If you're
Okay.
infected, you might not be, and also as a barrier to those virions gaining entrance into your body. So you're cutting down on your chances of getting to that infectious dose 50 level. And I keep hearing people, they're like, well, viruses are so tiny, they can get through that fabric. And that, it is true that viruses are very, very tiny, but most of the viral particles that would enter a patient and cause infection are going to be in large water droplets that were expelled through a cough or a sneeze, or even through talking, we can expel those droplets. And those droplets are not going to make it into your respiratory tract if they're stuck on that mask. And now you're thinking, well, won't you inhale them through the mask? It's a different aerodynamic. And in order for those viruses to get into certain reaches of your respiratory system, there is an aerodynamic involved there. So the data are showing there is evidence. And the problem is that people don't do well with repositioning their perspective if they've already decided. They've
Right.
already
That part.
decided,
Yeah.
and that's what we're facing, and that's a real challenge. But there have been a lot of studies that have shown that in areas where people have been wearing masks, that transmission is blocked, and that it makes sense with this infectious dose 50 model when you think of it.
Wow. And you said a lot when you said that once people have made their decision, because it seems as though if anyone that you talk to nowadays, well, not anyone, but just about anyone you speak to nowadays, if they are for vaccinations, they are passionate about it. Mm-hmm. And those who are not in agreement with vaccination, they are passionate about it. And once that emotion is involved in that decision, it doesn't matter what a person says, they will not receive new information if it goes against what they are passionate about.
Right.
And that is, I think that is one of the main reasons we are experiencing, such a high number of people who are not, who are still getting sick. Who are still unvaccinated and still getting sick.
Well, and it happens with a lot of things. I mean, the autism thing is another case in point. I mean, people feel emotional about it, especially if they have an autistic child.
Yes.
And they get very, very passionate about it. And I can understand that. I'm a mom. Mm-hmm. I have 2 children. Mm-hmm. And, they're vaccinated. They're vaccinated against COVID also. Mm-hmm. Because people like to say, do your research. I've done my research. I do research.
I wrote a textbook.
Like, do your research. It's like, I mean, I can't, I've done my research. I'm a mom and I care very much about my children, obviously, and have looked a lot at all of those things. And the data just don't support that. And certainly, if the data were suggesting that were the case, then I would need to pay attention to that. But yes, people have trouble switching gears. I think just even this whole thing about, hey, time to put your mask back on is a case in point example where people just struggle with something like that. I remember growing up. Do you remember when seatbelts were really controversial?
Yes, this was the seatbelt. That was the seatbelt when I was little.
Okay. Yeah. So
when the laws changed,
and it was there eventually was a law, right? Seatbelt law. But before that, there was actually a controversy about wearing seatbelts, and would that little strip of fabric actually save you? Would it prevent you from getting seriously hurt? And there were even things going around like, oh, if you wear a seatbelt, you're 10 times more likely to get decapitated in the car accident. I don't know if you remember that. Do you remember those anti-seatbelt ads? Yeah. And I was pretty young, and I remember asking like people in my family, like, is that true? Like,
yeah, my head gonna come off.
Like, that's terrifying. And my grandmother, who has passed a while ago, but she did not want to wear a seatbelt. And she would kind of brush it off like, oh, I'm not gonna wear a seatbelt. Why would I wrinkle my dress? And I know, right? It seems ridiculous. And I think what changed her mind was when I was about 9 years old, we were in a terrible car accident. And she was not wearing her seatbelt, and she hit the windshield, and she turned around, and I saw my grandmother with glass in her face, blood everywhere, and I started screaming, please don't die. Please don't die. Please don't die. And that was something that could have been prevented.
Right.
And I knew how helpless I felt.
Mm-hmm.
not being able to help her, and seeing that, and my little brother was in the car, and she said, "Don't leave your brother." It was just us. My parents were out of the country,
Okay.
so it was just us, and that was terrifying, and I couldn't imagine from my perspective, like, putting my own family maybe in that position where I could have done something to prevent something like COVID or getting really sick or whatever, and not doing it. Just like I go and get my wellness visits for, and routine mammography, all of these things as a prevention. It's not just about you, it's about your
Mhm.
family too, and what you might be
Absolutely.
putting them through. And I know a lot of people have lost loved ones to this,
Yes.
and they didn't have to. I mean, especially now, there are people who died before there was a
Yeah,
vaccine.
absolutely.
There were
Absolutely.
people who died before there was a vaccine, but there are people dying now despite there being a vaccine. And as
Mhm.
a medical scientist, I see so much pushback when we get a vaccine against cervical cancer. People don't want to get that. It's like, didn't you want a vaccine against cancer? And now
Right.
you don't want to take it. Okay. I mean, honestly, I what do you do? I mean, you go and you spend all this time and talent on things, and it turns out, like, people say, "Oh, it was developed so quickly." Not really. Mazikia
Speak
Corbett was
about
working on
that
that for
because
a
that
long
is,
time.
yeah, speak
She's
about
very
that for a minute because
Yeah.
yeah, that's something that people say, well, they don't have a cure for HIV and AIDS. Well, they don't have a cure for COVID either. It's a vaccine. So speak about that. People say, "Oh no, they came up with that too fast and what's in it?" You don't want to know what's in the water you drink, but you
Well, you don't know what's in all
what
that stuff they're gonna pump into you when you go to the hospital because you need care.
that too.
Okay, so let's think about
That
that, but,
too.
or you wanna take some other drug that's not even tested to treat COVID, and you're okay with that, but you're not okay with the vaccine. It's a complete disconnect. But I wanna be respectful because I know people are scared.
Mhm.
And what I would say is, one, there have been mRNA vaccine trials and vector vaccine trials, that's what the Johnson Janssen vaccine, for decades.
Mhm.
It's been worked on for a very long time. And it turns out when you throw a lot of money and a lot of professionals on a problem,
Mhm.
they can do stuff pretty quickly.
Right.
And you just look at the initiatives in our history where we have done that. We've done amazing things as human
Mhm.
beings. We've built the pyramids. We
Mhm.
put a man on the moon.
Oh, yeah. That
We fly in airplanes. Like, there are so
yes.
many amazing things that we do. You tap on your phone and you know where you are.
Mhm.
And to think,
That part.
like, okay, and you think that we can't do that also. And it's this conglomerate of scientists from all over the world working on this.
At the
And
same
at the
time.
same
At
time,
the
and
same time.
and
That was the
talking to
difference.
each other, and
Yes.
talking to
Yes.
each other, and trying to solve this
Mhm.
problem with a limitless bank account.
That too. Yes.
So you tell me, I mean, it's a real testimony, honestly, to what we can do
Yeah, if
when
we
we put
all
our
would
minds
just
to it.
agree. Yes, if we would all lay down the barriers and lay down, well, my country and this country, and we just talk, we just work together to find an answer.
Mhm,
Absolutely.
mhm.
Absolutely.
And the exciting thing too, the mRNA vaccines, they hold a lot of potential for protecting against a lot of things, and some possibilities even for vaccinating against certain cancers. So,
Yes. There's a comment on the screen. Are you able to see it?
a variant on the horizon that would be deadlier than Delta. I mean, it's possible. Anything is possible, right? Um, but that's why it has to be monitored constantly. And that's what's done with the flu vaccination program. Variants are constantly monitored for influenza, and vaccines are designed to protect against those new variants. And the same would be done for SARS-CoV-2. But yes, whenever a virus has a chance to mutate and change, it can become more dangerous. And it could become more transmissible. It could become deadlier. When we talk about viruses, there is always the potential for change. And this is true, I mean, emerging pathogens in general. In the past 50 years, we've had more emerging new pathogens than ever before. detected. You think about Zika and chikungunya, and we've seen chikungunya virus. Yes, that was a problem about 10 years ago. There were big outbreaks of that,
Oh,
mainly through Latin
okay.
America. It's transmitted
Oh,
through mosquitoes, but Zika you heard of, right? More
yes, yes.
recently,
Yeah, I
okay?
remember that.
And people remember it because it causes microcephaly in
Right, it
newborns.
is. Right.
Uh,
I
if
remember
if
that.
if the mother's infected during pregnancy, at a certain stage in pregnancy. Um, and Ebola. I mean, Ebola has become a real there's a vaccine against Ebola now, by the way, and guess what?
Hmm.
It's an RNA vaccine.
Okay.
So, I mean, oh, sorry, no, it's a vector vaccine. It's like
Mhm.
the Johnson Janssen. Um, and it's been very helpful in combating the Ebola outbreak in sub-Saharan Africa. But yeah, I mean, emerging pathogens are a thing, and they'll continue to be a problem because we're globalized and we go places now. Things that used
Yes.
to be isolated get spread much easier.
Much faster. Yes,
Mhm.
definitely. Well, very good. Well, thank you so much. I think right now we're going to, normally, the show is usually around 30, 40 minutes, but, this was an important topic. So we had to take our time and just break it down. But I did want to do a quick commercial break and thank our sponsor. And the sponsor just happens to be me. With my other brand, and my other brand is Fight to Smile. And Fight to Smile is a campaign for career minded women and just reminding women that despite the challenges and the struggles that you go through, just stand strong, hold your head up, and despite the tears, continue to smile. So here's my little commercial. Yay! That's Fight to Smile. So you can follow me on Instagram, on Facebook, and I share motivating, positive, encouraging, and enlightened content for women who are career minded and who are determined to win. So, with that, Dr. Lourdes Norman-McKay, do you have any final thoughts or any last comments that you'd like to share? And I'm checking Facebook. I don't see any new comments. And I don't see any new comments on YouTube. Ellsworth did say that why hasn't the government or the CDC made an official public presentation on COVID, the variants, causes, vaccine, facts, myths, Q&A for the American people?
I think it's a great idea. I think that we need to have scientists talking more in a way that the general public can consume and understand it. And that is something I am really passionate about doing more of. Um, and I would just say we have to work together. We can't be at each other's throats on this. And I am not in favor of violence or aggression against anyone based on, whether they're wearing a mask, whether they're vaccinated or not, and none of that. Like everyone is trying to survive and do what they want to do for themselves, for their families. Um, and there does come a point where we have to pull together.
Yes.
We really have to pull together. So I would just say, open your mind to the fact that there are scientists who are really trying to do the right thing here and
Mhm.
ask questions of your healthcare provider. Ask the
Mhm.
person who you put your health in their hands every day and talk to them with your questions. So that would be my advice.
Very good. Well, thank you again. I appreciate you coming onto our show. I'm sure the viewers have enjoyed it. I've been getting a few texts and comments, and people are saying this was really great information. So I really, really appreciate you being here tonight. Thank you so much. And do you have, are you on social media? Do you have followers or anything like that?
I'm on LinkedIn. I have
Okay.
Facebook, but yeah, that's about what I have time for right now.
Okay, I understand because you're busy writing more textbooks. This is phenomenal.
Oh,
So we appreciate all the work that you have done, that you will continue to do, and you are such an inspiration, not just to the young women, but to your peers, to your friends. You are such an incredible inspiration to women in general, scientists, everyone. We appreciate you, Lourdes. Thank you so much for
thank
being on
you.
the show tonight. And everyone, thank you for coming tonight. I appreciate you. And we will see you next time. Take care.